Hello, everyone. This evening we're going to talk about glaucoma. I had a question on the live where someone was discussing if glaucoma had treatment. So I'm going to discuss glaucoma today and what you need to know about glaucoma. Glaucoma is a problem with the eye where there's increase in pressure more than the eye can hold. Usually, we see the normal eye pressure is between 10 to 21 millimeter of mercury. If you compare to the blood pressure is between 100 over 60 to 120 over 80 millimeter of mercury. So, the eye pressure, the pressure of the fluid inside the eye, between 10 to 21 millimeter of mercury. That's the normal. When the pressure goes beyond this, it's either that the secretion, the production of fluid in the eye is more than the eye can take, or the openings where the eye removes or drains some of the fluid is blocked. So this pressure backs up and accumulates. And then this pressure goes back to damage the nerve that takes images from the eye to the brain for interpretation, the optic nerve. We should also note that glaucoma can even happen at normal pressure if the drainage is blocked also. It can also occur at any age. So while we notice it more in older people, we can also notice in some other diseases and in younger people. It may not give you any warning signs. You may not notice any symptom. The disease condition is very gradual that you may not even notice that your eye, your vision has begun to change. You may not notice any change till maybe it's profound or too late. If you discover on time, especially for those that do routine exams, eye exams, hospital visits, you check the pressure of your eye regularly. If it's caught early, glaucoma can be reversed, it can be treated, but you still need to be monitored all through life just to be sure that the pressure is not increasing, changes are not occurring without you knowing. The symptoms now, for those that now display symptoms, depend on the type of glaucoma. For instance, we have open angle glaucoma, we have the acute angle or the close angle glaucoma, the normal tension glaucoma. We also have glaucoma in children. We may also have pigmentary glaucoma. Like I said before, the symptoms will depend on the type and the stage of the glaucoma. So you may have things like blind spots in your eye, headaches, difficulty in seeing or blurring of vision, nausea, vomiting, severe headaches, eye aches. There may be redness in the eye. You may notice halos or rings in your vision or in the eye when you look at it. In children, you may notice dull colored eye and even loss of vision in some cases. You may notice increased blinking in children. You may notice crying without tears. The children may complain of headache. You may notice nearsightedness that is getting worse. So many things, blurred vision when you exercise. Like I said before, it is caused by pressure on the nerves that take information to the brain. This pressure is caused by problem with the draining of the fluid in the eye or the pressure from excessive production of this fluid in the front of the lens, the aqueous humor, the back of the lens, the vitreous humor. This pressure can move and then begin to impinge on the nerve and then cause damage. We notice it more in people that have high intraocular pressure, that is the pressure in the eye, people that are older than the age of 55, people of black, Asian, or Hispanic heritage, people that have had family history of glaucoma, father, mother, sibling, people that have diabetes, migraine, high blood pressure, sickle cell anemia, people that have extreme nearsightedness or farsightedness, people that have thin cornea, people that have undergone certain types of eye surgery, people that have been taking some kind of corticosteroids, medications for a long time, and of course, some people that have had some kind of eye injury before. These are the people that will notice it more. How do you prevent it? Avoid trauma to your eye. That is wear protective eyewear. Do routine regular checkups. It's not just going to see your optician. Optician is the one that does the glasses. Your ophthalmologist, they take care, that the doctors that are specialized in taking care of the eye. So you do routine visit maybe once a year, twice a year, as your insurance or your finance allows. Know your family history. Do not overuse medications that are given to you, especially eye drops. And do not pick any eye drop and just use. Make sure they are prescription and are used as described. When you find out any of these symptoms, maybe from routine exams, or you notice any of the symptoms at home, you go and see your doctor. Your doctor wants to examine your eye. This is what you call an ophthalmoscope. The doctor will examine the eye to look at the back of the eye to see, is your eye affected by the pressure? Are there changes at the back of the eye? Is the fluid blurry? So many exams will be done. There are other tools to use other than this. In my clinic, I have an electric one. So other tools will be used to be check how healthy your eye is. Your ophthalmologist wants to check how high or what is the pressure of your eye. We call it tonometry. Tonometry, they will put something on the eye just to get the pressure to measure it. It should be between 10 and 21. Also, they'll ask about your history. Do you have diabetes? Do you have sickle cell? Do you have anemia? Do you have hypertension? Do you have migraines? Do you have a family history? What drugs are you using? Are you on any other medication? These are the history taking that they will do. They also want to check how thick is your cornea. They call this pachymetry. They may do a field test to check, okay, can you actually, what's your near vision like? What's your far vision like? Do you have 20/20 vision? Do you have a far sight or a near sight? All this should be done by the ophthalmologist in the clinic. And the treatment will depend on what they find out. There are so many medications that are used, eye drops that can be given that can adjust the eye, and in other cases they may even go into surgery to see if they can open up the drainage from the eye to allow the fluid to go normally. They call it the trabecular meshwork. If it allows fluid to go out of the eye in a cycle properly and maintain that pressure, and of course routine pressure check and eye exams also. Surgery may include laser, so many other surgeries. Please see your doctor to discuss this. It shouldn't be the end of your eyesight. If it's not handled properly, it can lead to blindness and it may recur. So you need to be checking routinely. I hope this helps. I'll see you guys on the next one. Bye bye.